resources. I am standing here before you today simply because of this medication right here.
Wow.
Right? I would not be standing here if someone not had access to Narcan. More importantly, knew how to use it and wasn't afraid to use it. All right, so we'll talk about some of that stuff as we go. Okay, so that's what we're talking about, guys, right? Overdose prevention. So before I even talk into this statistic, why this is so important that we all know how to do this, right? So one of the scariest statistics out there, I'm sure some of you guys seen some of the statistics out there for the opioid overdoses in the state, the country, right? Some of these horrific numbers, right? The scariest statistic to me, 3 out of 5 overdose deaths could have been reversed by an intervention. Okay, that means there was a bystander present that did nothing. Okay, either they were ill-equipped, right? Meaning they did not have Narcan, or they had it and didn't know how to use it, or even scarier, they had it, knew how to use it, but were afraid to do so. We're afraid to do so. So I'm going to talk about a couple of things as we go here to mitigate some of that risk, liability, hopefully, and give us some of that confidence we need to be able to properly identify an overdose, signs and symptoms of an overdose, and then how to properly respond. Okay, as you can see, if you do a little pre-test here, this is some of the stuff that we'll be focusing on. Okay. And then, like Evelyn said, we'll have part 2 upstairs, which I'm going to be doing more of like an addiction 101 and a harm reduction approach, okay? Which is very important too. Okay, so we know, may or may not know, excuse me, right, that Narcan is the only medication that we know of that can reverse an opioid overdose. Okay, it does this by removing the opioids from the receptors in the brain, freeing up the symptoms in the brainstem to allow us to start breathing again. Okay, one of the areas that is affected by this disease in our brain is our brainstem. Our brainstem controls and regulates our senses. Okay? So I know this is kind of small, guys. I apologize. You got it on a big screen. Okay, so this says illicitly manufactured fentanyl, heroin, cocaine, or methamphetamine, okay, alone in combination, were involved in nearly 85% of the drug overdose deaths. 85%. So this is from 2019, those statistics. So we know that, you know, they fluctuate. But okay, and the reason I put this on here is because a lot of people know and realize, you know, it's for opioids. There is no heroin out there anymore. It's fentanyl, carfentanil, xylazine. But not a lot of people take into consideration that it's in every other substance. Okay, we had an individual this morning talking to us at our table, had an overdose yesterday from crack cocaine. Right? Was using stimulants, unaware of the risk involved, right? Someone had Narcan present, was able to Narcan, you know, and then I'm giving an opportunity for life and engage in treatment. Okay, so this is that statistic. More than 3 out of 5 overdose involved at least one potential opportunity to link people to care before an overdose or to implement life-saving actions, right? Some of the stigmas out there is that we're enabling using. Only thing Narcan enables is breathing. That's it. That's it. I stole that. It's not my own tagline. I saw it on a bumper sticker or someone's t-shirt one day. I'm like, I love that, right? That's exactly what it is. Even if multiple overdoses, just like myself, I have multiple overdoses under my belt. You know, not my finest hour, not my proudest moment, but I'm saying that to say this, that we never know when that next opportunity is or that willingness will present. You know, it usually is after an overdose, something like that, right? Unfortunately, with this disease, pain is the greatest motivator, right? So when the pain gets great enough, hopefully the willingness will present. You know, we want to be able to give someone the opportunity and the space to be able to do that, right? To meet the individual where they are. Okay, so how does an overdose occur? Okay, a variety of effects can occur if a person takes opioids, ranging from pleasure to nausea, vomiting, severe allergic reactions, anaphylaxis, and overdose, in which breathing and heartbeat slow or even stop. Okay, so what puts people at, oh, we don't have our, where's the diesel thing? I'm sorry, guys. So I just made this like 2 weeks ago too. Flew up a board that has like risk factors for an overdose, which puts someone at higher risk. Okay, so what puts someone at higher risk, which Katie will have that in a second to put that up for you, and it has pictures on it too. Is someone that just had length of abstinence, so someone released from a hospital, someone released from incarceration, someone just released from detox, right? So someone's been actively detoxed, been physically removed from their substance for any amount of time, is now at higher risk for overdose if they do consume opioids again, right? That tolerance is no longer there, right? Our brain doesn't work that way. Even if it does, right? It's just a personal experience, right? My God willing, my last overdose was just $20 worth of heroin it was fed. right? Prior to that, I would use a lot more. That's what I was used to using, right? I had an overdose. I'm like, okay, I'll be safe. I'll use less than I did previously, and it still didn't work. It still didn't work, you know. I didn't have the tools. I didn't. That's it. That's not true. I knew fentanyl testing strips were out there, right? I just wasn't in a place yet to make sure I had them to be able to use as safe as possible.
So a person that's sober and in recovery is at a higher risk of overdose.
Exactly.
Wow.
Yeah,
Okay.
exactly. Right. You would think it could be quite the contrary, right? Just like, you know, you get a sickness, you get over the flu. Now, next time it's harder to get the flu because you got the antibodies and the helper T and the memory B cells or whatever's in there. I'm not a nurse or a scientist, but yeah. It's actually quite the contrary with substance use. You know? So that's what we want to keep eyes on. You know, if you see someone coming in, you know, said, I just got out of treatment yesterday, you know, or a couple of days ago, and you think that, you know, they might have an opportunity to be exposed to opioids again, we want to try to keep a little bit more eyes on these individuals, you know. And opioid overdose can be due to many factors, right? It can occur when a patient deliberately misuses a prescription, right? So sometimes it's deliberate, you know. Uses illicit opioids such as heroin, or uses opioid contaminated, right, or contaminated substances, right? The big ones: cocaine, methamphetamine. You know, so it's kind of expected out there now that if we're buying pills, right, from the street pharmacist, excuse the expression, right? You know, oxys, Percocets, Dilaudid, morphine pills out there. They're pressed pills. There's a high probability that there's fentanyl in it, right? So I tell everyone, rule of thumb: if we're using opioids, there's fentanyl in it, and use that mentality and be safe. Make sure you have Narcan present. Make sure if you're a solo user, you have the Never Use Alone hotline number, which we have these cards for that we can hand out. Try to mitigate some of that risk. Also occur when opioids are taken with other medications. So the big two, which are at high risk, is benzodiazepines, which is Xanax, Klonopins, Valiums, things of that nature, and alcohol. Okay, so those are the big two that increase your risk. So if someone is polysubstance using, you know, you smell someone coming in with alcohol on their breath or something like that, a concern, we want to lay even thicker eyes on these individuals, you know, because it does put them at higher risk.
Say that again, the last thing you said.
Putting them at higher risk?
Putting them at higher risk.
Yeah, it's at higher risk. This guy.
I apologize, you're going to be competing with the fridge right now.
It's quite all right. I'm up for the challenge. Come on, Fred. Okay, so let's a little bit more. Who is at risk? Anyone who uses opioids for long-term management of chronic pain is at risk for opioid overdose, as individuals who use heroin or misuse prescription pain relievers. Others at risk include they are receiving rotating opioid regimens. Okay, so like maybe not a consistent prescription, right? When pain arises, you know, you go to your doctor, they give you a script, you know, and that height of that chronic pain or that acute pain, right? Some will be more inclined to over-medicate. You know, take an extra, use something on the side. You know, I'm having trouble sleeping because of my pain and my, you know, my oxys or my pain medication isn't working, so they might try to take something and include on top of, you know, try to get some quote-unquote relief. Puts individuals at higher risk. Okay, so people that have been discharged from emergency medical care following an opioid overdose. Now, I didn't learn this until I was already working in the field, so I'll give you a little scenario. Right, so I'm doing an intake, brought an inpatient. I was a clinician on the detox for a few years over there in High Point. Woman was transported by the EMTs in an ambulance from Good Samaritan Hospital, which they notified me she was had a recent opioid overdose. What they did not educate me on was that she is able to re-overdose without re-administering opioids. Okay, so the Narcan has a shorter half-life than the opioids do. Okay, so meaning, if you Narcan someone, we want to observe them or get them immediate medical care where they can be observed for 4 hours or more. Okay, because the Narcan can wear off in 30 to 90 minutes. The opioids for 4 hours, so someone could re-overdose on the same dose of fentanyl, heroin. I didn't know this. You know, I'm putting this woman's property in the computer. I turn around and she's overdosing again, which I'll get into the signs here in a minute, what to look for. And immediately call a code, call a nurse, saying that she's got drugs on her. how the heck did she use while I'm doing her intake? And then the nurse provided me with some education, you know, and that was what kind of got me intrigued and interested in this and started pursuing more education on this because it's just not readily available, you know. It's not common knowledge. Okay? So, people who have completed an opioid detox, which you just talked about, okay, or abstinent for a period of time, presumably have reduced opioid tolerance and a high risk of return to opioid use. Okay, so that one, return to opioid use, people will gravitate towards other substances, right? Because we know opioids are dangerous, right? So myself included, I knew this. I knew I could overdose. I knew I needed to stop using heroin and opioids. I didn't have the ability, the learned coping mechanisms to be able to do so. So if I was irritable, restless, or discontent, I would go use another substance to try to get some relief, excuse that expression. Okay. Now in doing that, I would always circle back to my substance of choice, whether I started with marijuana, alcohol, crack cocaine. At the end of that, I was back to back on opioids again. And in that time, we're at our highest risk for overdose. Okay, we're at the highest risk for overdose. Okay, which we have up here. Now, flip it over here.
The board, because I don't know if you want, if you're gonna use the board.
Let's
Put it on the other
relocate.
side.
Let's relocate it.
Yeah.
You're gonna have to edit this.
There you go.
Okay, now it's hopefully I can stand it. Stand sideways, everyone can see it? Stand sideways, okay. Does that see me over here then?
Yep, you're on the ground.
Guys, that's what this talks about. Change of tolerance. Once again, I'm a visual learner. So when Courtney was up at the office, we were talking about this. We have these little cards that fold out. If anyone wants these, let us know. The little K cards that fold and unfold with all of this information on it. It's the size of a business card. Okay, so what we did is we just took that and blew it up. All right, because this is the key points of identifying and responding to. All right. Hey, the big one, which doesn't get enough attention, right, which is the same theory. If you've been removed from your substance, but have recently been released, from incarceration and have a history of opioid use. All right, now, people that aren't familiar with this disease, like homeboy just did a year in jail. The last thing he's going to do for an opioid-related charge, right, the last thing he's going to do when he gets out is go back to opioids. Unfortunately, this disease doesn't work that way, right? Which we're going to learn upstairs, Addiction 101, the dopamine, the disease model of this brain, right? How this disease works on this brain. And yeah, this isn't it's not always a choice. It's not always that simple, which we'll get into. Okay, strategies to prevent. Okay, encourage providers, persons at high risk, family members, and others to learn how to prevent and manage opioid overdose, which is what y'all are doing right now. Right, and it warms my heart seeing so many people in here, right, with the desire to learn, right, to learn more. Some of you may already know this stuff, right, it may just be, a refresher for you, but regardless, you're here and you're interested in being a part of helping someone. This medication saves lives. It gives individuals another opportunity to engage in treatment. So if you, family members, people in your church, that are experiencing opioids that you see, right, on a regular basis or even an inconsistent basis, let's try to be educated and be ready to respond if we need to. Right? So ensure access to treatment for individuals who are misusing opioids or have substance use disorder. Right? Where do we go? All right, let's try to catch them. There's three parts of this disease. All right, she kind of summarized it for me, right? There's prevention, intervention, and recovery. Right? Prevention, intervention, and recovery. And it all matters where that individual is at. Right? So we were talking about, be able to provide an intervention, right? So if we do experience someone or assist someone that's experiencing overdose, what education do we provide to that individual after? We're not just going to go, okay, so you know what I mean, right? I hope not. If that's what you do, I'll take it, right? At least minister the Narcan before you bounce, please. But yeah, what do we do next? How do we engage these individuals? What services do we try to connect them to and things like that? Right? And I'm not here talking High Point because I'm not here to try to sell you on how to connect people to High Point services. It's not what we do. There's nothing to do. Okay? Encourage the public to call to ensure ready access to the naloxone, which everyone, hopefully we handed out a lot this morning, which was great. But on the flip side of that, it took away from, I wanted to make sure every one of you guys had a kit in your hand.
We have some in the closet.
You have some too? Okay, awesome. And if not, if we need some more after, I'm more than obliged, to transport some up here, hook Courtney up. So, encourage the public to call 911. Okay, because you guys seen your steps, we'll go over here in a second. Has anyone not heard of the Good Samaritan law? Everyone's heard of the Good Samaritan law? Okay, I love that. Right? So the Good Samaritan law, this is a law imposed in Massachusetts to mitigate any liability for those that do administer Narcan to reverse an opioid overdose. Okay, so if God forbid there is an adverse reaction, and I'll share with you, it's only been documented 0.1% are allergic to this medication. 0.1. And it's been administered, I couldn't even tell you how many millions of Narcans are out there. I actually kind of want to get that statistic now. So if that's your concern, don't. Okay, Narcan only works to reverse an opioid overdose, right? It will not work to reverse anything else. If you suspect someone is overdosing on opioids, administer the Narcan, right? And if it doesn't need it, they don't need it, it won't work. If they need it, it will. Okay, which we'll get into our signs to identify in a second. Okay. So we'll see here, while we're talking about 911, okay? We call 911 first. So we'll go, actually, let me back up for a second. What are we looking for? What are we looking for? Signs of an overdose, right? Someone sleeping or nodding out is not an overdose. It's not an overdose, right? Could they be on the, there it is, not necessarily, but it's enough to get your spidey senses tingling. Right? If we see someone nodding, like, okay, you know, like we saw Courtney, guys did great. I seen it today. It was very well orchestrated. Ones that were coming around slowly, I seen it. Volunteers there, they're standing. Okay. Make sure you get a response. Okay? We want to try that verbal stimulation first. How you doing? You okay? I know you're tired, bud. Right? It's tired out there. It's been a long day. I'm sure.
Exactly.
But if you're getting some of that response, right? And so we're coming from a place of empathy. That's the most important part, right? If someone feels judged, right, or like they're kind of chastise me for overdosing or for using opioids, they're gonna clam up, right? And even if they're able to wake, they're gonna be resistant and hesitant towards that. We wanna bless you. We wanna make sure we're coming from a place of concern. How can we help? We're here to help, right? Keep someone above ground, right? Okay, so if you see someone copping a nod, excuse the expression, right? If you know their name, try using that name. Try using that verbal stimulation to get someone aroused. If that doesn't work, right? You know, try touching the shoulder, things like that. Don't start shaking someone. Don't slap someone in the face. You know, don't pinch them. There's no need. How would you like to get pinched? Wake up from being pinched if you're taking a nap, you know, or you've been on the street for the last 3.5 months. You know, you finally get a place where you feel safe enough to close your eyes, right? That's a big one. And someone just to startle you, wake you right up, you know. The magic word, though, for verbal stimulation is the word Narcan. I know this from working inpatient. Okay, if someone's on the verge, if you think someone's on the verge or they're copping a nod and non-responsive to your verbal cues, say, buddy, if I don't get a response, I'm gonna have to Narcan you. Then you'll get a, oh no, I'm okay. All right, but at least they're up. Okay? If you do not get that, now you want to try your physical stimulation. Okay, your physical. And this is what we're looking for before we start on with that. Okay, clammy, cool skin. All right, so we started there. Step 1, person won't wake up or respond. Okay, to the verbal cues or stimulation. Okay, you see some clammy, cool skin. You may see some blue lips or fingertips. Okay, shallow or slow breathing. All right, some of the verbs that are out there, that gurgle, that rattle sounds like snoring, baby. You know, shallow breathing. Okay. Slow pulse or heart rate. Seizures or convulsions. You know, those are pretty obvious symptoms if we see those. You know, some of them are not so obvious. Okay, but that snoring or the gurgling noise, they call it the death rattle out there. You know, and I don't know if any of you have ever experienced that. It's someone really struggling to gasp for air. Okay, really struggling to gasp for air. Okay, now if that happens, you've tried your verbal, you've tried the magic word. That doesn't work. Now we want to try physical stimulation.
Say what the magic word is again?
Narcan.
Yeah.
Narcan.
Or 911.
Or 911. Or exactly. Yep. Gonna get an ambulance here. No. We call 911.
Yeah.
If that doesn't work, now we're gonna try the physical stimulation.
I have a question. Why they don't want the ambulance to show up?
What if they don't want the ambulance?
Why don't they?
Why they usually refuse the ambulance treatment?
Why do they refuse? Because they've had a negative experience.
Yeah.
Usually, they're untrustworthy, right? I don't trust them.
Yep.
Right? I feel like they're either gonna lock me up, take my drugs, force me into treatment, right?
Yeah.
They can force them.
all the above, so they can section someone, you know,
Yeah.
I don't want to get into too much of that, but a section 35 is someone, you can legally commit someone to treatment with a judge's order
Yeah.
if they're at risk of harm to themselves or the community. You know, in a section 35, and go through that process, and maybe that has been an experience, you know. So I like to have that conversation, you know, we try to get you.
But not that they're gonna get in trouble with the police. Is that what they feel?
That's probably the biggest fear.
Yeah.
Because ambulances very seldom come by themselves.
Right.
When you call 911, right? Especially if you say it's an overdose. So my tip of advice for that, if you're calling for an overdose, do not say it's for an overdose. Say you have someone that is unresponsive. That's unresponsive. Unfortunately, there's very much still a stigma attached to this. You know, it's especially if it's to an area or a residence that they've responded to before.
Yeah.
You know? Yeah. Not all first responders, but unfortunately, it's getting better. It's getting better. You know, it's getting better. We work pretty closely with some EMTs and some first responders, you know.
I just have a question, the police can lock them up for that?
So police officers
Why
cannot,
they fear the police?
probably they fear. So they can't lock you up for overdosing per se, right? Or suspected using, right? But that does give them probable cause.
Or they could have a warrant or for something else to.
That's a big, that's a lot. A lot of people that are out there, you know, myself, when I got into my warrants in 3 different states, you know, I said that with a smile. Not because I'm proud of the warrants, because I no longer have these warrants. So as soon as I start to talk about it, like yeah. I don't run when I see an ambulance anymore. And what a beautiful feeling, right? I don't shit my pants when I see blues anymore. It's a beautiful thing, a beautiful thing. You know, and that's what we're trying to give someone an opportunity. Shoot,
You said call 911 first, but I've heard stories of like 911 stopping people from using Narcan. So like, because of the stigma.
Oh,
So it's
yeah.
like, what do you suggest? Because it's like I'd rather save the person's life than like
Cool.
911.
Cool.
Like,
So there it is. So, I mean, you want, and it's a heat of the moment type of thing. You know what I'm saying? If you have the time to call first responders, if you've identified some of these things, right, you're pretty confident you're going to administer Narcan, get them on the horn and get them on the way for a couple
Okay,
of
if
days.
you're gonna do the Narcan, get someone else. Say, hey, you call 911.
Yeah.
It's good to
Yeah.
pick the person, or else nobody will know who's doing it.
That's it. Yeah, and because you want to get them, because if there's a lag time when we want to make sure they're coming there as soon. Because hey, you may not have enough. Share with you, God will, my last overdose, it took 5 of these.
So, for our experience from being here, when we call, they usually say, "Don't do it. We'll be there really soon."
Oh, no.
Yeah, they've done that a lot. Like they're like, no, and then they don't do it the same
Okay.
way. They give them another. It's like they inject it or they do something different.
Okay. So, this is pure speculation for that, for why I think that what reasoning is. But if you've ever, anyone has any experience administering Narcan, especially if you administer multiple of them, they wake up in precipitated withdrawal.
Yeah.
Very uncomfortable.
Very uncomfortable.
Right? So we put them to day 3 of withdrawal, like that. Like
Mhm.
that. You know, so it comes with symptoms.
Yep.
You know, now they're physically ill,
Yep.
nauseous, pain,
Their heart beats fast.
right? Heart palpitations, even, right? Panic, anxiety, and overstimulated amygdala, right? So that fight or flight is kicking in, you know, and they've gotten combative, you know, with EMTs or first responders before. So like I said, this is pure speculation. This is recorded too, so I gotta watch myself, right? But I feel like they want to be the ones to get them to wake up.
Yeah.
You know, that way they can see how that happens, see how they can react, respond. But if you feel like
That's
some-
only because Boston Medical is right there.
right around the corner.
Yeah.
So this isn't a great spot, you know, but even still, a lot can change in seconds, even minutes.
Right.
You know, so if you have it, you've identified it, you feel confident, there's a good Samaritan law anyway, right? So even if they didn't need it, even if it's not opioids, it can have a negative effect. Administer the Narcan.
What did you mean about the Good Samaritan law? You're saying don't do, you have to do it?
No, you don't
Yeah.
have. You don't have to, right? So, but there is, if you do, and God forbid there is a negative or adverse reaction, the person that administered the Narcan is not liable. Another part of that is you do not have to disclose your information either. Okay, so if first responders do get there, they say, "Great job, honey. I love that you Narcan this individual. Can I just have your name and date of birth, please?" There it is. You're like, you don't need that. You know, and that's completely.
Why do they want it?
Why do they want it? Sometimes it's for a couple of reasons, right? Other ones, they want to see if you got warrants, right? It's not to send you an award or a certificate in the mail. I promise you that. Promise you that, right? So if they have your name, your date of birth, your address, and phone number, get your spidey senses going. You know, they're fishing, you know, and a lot of it's because they have jobs to do too,
Right.
and they're investigatory, you know, they're looking for others that they could potentially help too, you know?
I'm sorry, you might have already said this, but the it's really loud, I couldn't hear you.
Fridge.
You mentioned, not to tell them on the phone that they've OD'd, like, make sure you tell them that they're non-responsive. Why, and you might have already explained it, but why do we need to, like, say that instead?
Because unfortunately, there is still very much a stigma associated with it. You know, so if say they're getting 3,000 calls that night, right? They got one for a heart attack, they got one for a potential gunshot wound, and they got one for an opioid overdose. And I hate to say it like that. You know, if they had to pick, you know, which one takes priority, unfortunately, you know, the opioids is going to...
Especially around here.
Yeah, exactly, because they deal with it all the time.
Right.
All the time. They're probably like, oh, it's freaking Jerry again. You know? Yeah, you know, it's happened. And multiple encounters with multiple of the same EMTs. And I'm super grateful I have a positive relationship with these individuals now, but back then, not so much. Not
Do
so
they
much.
legally, are they able to, like, not show up?
No, yeah, they need to show up, right? But there's no law that says how quick they need to show up. You know, it's as quick as possible. And that's why we want to give them just enough information so they know it's an emergency. I have someone non-responsive, not breathing. Something like that. You know, would it say unresponsive, not breathing, and there's a needle hanging out of their pocket? Leave that little detail out. Important stuff, but in the time when it's needed, you know. How we're going. Okay. So we kind of talked about these, right? These are the signs of an overdose. This is why I use a PowerPoint too, to keep me on track. And if I was staying on track, I'm sorry guys, the ADHD is very real with this dude. You know, it's very real. I never claim to be well, I just claim to be in recovery, you know what I mean? All right, so we already went over this stuff. The fingertips, all right, the blue, you try the verbal stimulation, calling the person's name. If that doesn't work, vigorously grind knuckles into the sternum. So that's the physical stimulation. You want to be my guinea pig, Jonathan?
Sure.
Come on up, bro. Come on up, man. Okay, so we'll try the sternum rub first, right? You're not going to break their solar plexus sternum. I'm not going to hurt you, I promise. I'll do my best not to. Right, so you're just rubbing your knuckles, the middle of their sternum right there.
The cat loves that.
Right, so cats love it. My dog loves it too. People, not so much. If you're unsure, do it to yourself. Right? Don't hurt yourself, don't bruise yourself, right? But just stick that knuckle in there. You feel that. You feel that.
What
Right?
are we supposed to feel?
Pain.
Oh,
When you push it in. You know, you're supposed to feel discomfort. Like I said, you're not trying to hurt the individual, right? But we do need to cause that physical stimulation to get them, okay? If you get no response to that, we go to the upper lip. I'm not gonna worry, I'm not gonna lift you. I'm not gonna lift you, bud. Okay, but if you try that, you know, like don't give yourself a bruised lip or anything, but you know, you push it up against your teeth or your gums, your upper lip, that is not comfortable. That is not comfortable. You know, that's that verbal stimulation that we want to try to do to get them to, you know, to arise before administering Narcan. Another one, I'm gonna say this too, because we had this a couple times ago. What was that? 2 times ago we were here. Was suspected overdose here in the community from the guests coming in, and you know it was Narcan and shaking her. Right, she'd come to and go back out. Right, there's a lot of get them up. Get him up, Courtney, come for a walk, come outside with me, right? Let's go smoke a cigarette, whatever it is, we'll get you a cup of coffee, right? Don't just wake him up to have him go back up. Wake him up to go back up. Wake him up to go back up. You know? Get him up. It's a verbal stimulation. If you know their name, use it, right? You know your favorite song, sing it. You know, whatever it is to get them going and get the juices flowing again, you know? And make sure you're coming from a place of concern and empathy, right? It's not like I'm trying to get you up out of here because you're an embarrassment. Right? Or people are looking at you or judging. No, I want to make sure you're okay. I want to make sure you're well. Right? Make sure you're able to receive some assistance or some support or guidance, prayer, whatever it is that they're trying to receive. Give me goosebumps. Okay. And so if they do respond, Seth, whether he or she can maintain the responsiveness. What I was saying, that's why I was saying that to say this. All right? Make sure they're able to maintain. Can they sit up? They stay. And you see them. Are they in there? Right, or are they, you know, their eyes bouncing around in there? Can you see them? Can they see you? Right, are they acknowledging your presence? And then continue the monitoring, right? Including breathing and alertness, right? So you're aware of this, less than breath every 5 seconds. Okay, so we have done. Okay. If the person does not respond, we're going to call 911, provide rescue breathing. Okay. So, I don't like you get conflicting stuff. I'm not going to turn this into a CPR training, right? I know there's conflicting information out there, right? Whether you do chest compressions, you don't do chest compressions, you breathe, you don't breathe, right? If you don't have Narcan, you can only do one thing and one thing only. That's provide rescue breaths. Right? It's provide
Right,
rescue
what?
breaths. Right. So that's why we have the CPR mask there, because I carried it on my badge with the mask and the Narcan, right? And I share this, right? I would here from Narcan here because of Narcan, right? My sister had to breathe for me for almost 12 minutes while we were waiting for first responders. Right? I don't remember any of this, of course. This was reported to me after I got out of treatment. Because my sister was EMT trained, right? She worked for Brewster. She had the foresight to say, all right, I got to do something, right, to keep oxygen going to the brain while we're waiting for first responders, right? Providing those rescue breaths is very important, right? To make sure, improve their quality of life when they do come out. When they do come out, oxygen deprivation is very much a thing and it's very dangerous and risky. Call 911. Don't be scared. It's okay. They're there to help most of them, most of them. And it's different from us because we're not the ones using opioids. It's received differently. We're not calling from the trap. We're not giving them an address that they know they've been to. There's huge amounts of drug use and stuff. So this is a big paragraph, right? That talks about what we already said. So say someone is unresponsive and not breathing. Okay, don't say someone is having an overdose. Okay, be sure to give specific address or description of your location, as many description as you can. Right, so they know where to go. Say, I'm outside Lion of Judah Church. I'm on the east side, right outside of Reed Street, whatever it is. To give them as many so they're not driving around the block looking for you. Okay, we want to give them as much information as we can. Okay, you call 911. Now we administer naloxone. Okay, so the rule of thumb from naloxone. So I see this is kind of going to put a trick question out here. Right, every 4 to 5 minutes. Okay. So it's actually every 90 to 180 seconds is kind of ideal rule of thumb, right? But now, I don't operate that way. I've responded to now 18 overdoses, living in this industry, working in this field. I don't do that. I don't administer one, wait 3 minutes. If you've been in that situation, 1.5 minutes or 3 minutes is a very long time. It's a very long time. Your adrenaline's going, your anxiety's going, right? I'm not getting a response. I'm gonna keep whacking the person, excuse the expression, I'm not actually whacking them. I'm gonna continue hitting them with Narcan until I get that response, until I get them up. Okay. And a lot of that stigma out there too, that they wake up swinging, that's not really a thing. It has happened, as long as someone's gonna shoot up and wanna knock you out, but they're gonna be scared. How would you be? If you're unconscious, say you hit your head and you're unconscious, you wake up and you got 17 people around you, you got flashing red and blue lights, right? The lovely smell of Narcan dripping into your throat. Right? We're not gonna wake up like, that was a nice nap. We're gonna shoot up or get defensive, so make sure we're aware of that. Give someone the space that they require, so I know a lot of us, we're helpful people, right? We wanna help, we see someone, we kind of gravitate towards that person. Let the designated person take care of it, right? Or whoever's gonna be right here. If you're gonna have volunteers assigned to that, whatever it is. Even if you wanna be a part of the mix, then go up, but do you need some assistance? If not, let them handle. Sometimes less is more in these situations, less is more. They'll be more inclined to have a conversation, more receptive to receiving guidance or education, connection to treatment. Super.
Just to be clear, is naloxone the same as Narcan?
It is. So Narcan is the company name, is the brand name. Naloxone is the medication. It's the medication. Okay, so let's talk a little bit about, so I'll talk briefly about it, right? I'm not going to make it a CPR class, but be sure that the person's airway is clear, check that nothing is inside the person's mouth or throat, blocking the airway. I probably should show you guys how to administer Narcan first, huh? Let's go with that. See, I've been doing this for years now, and it's like, oh, you know what I mean? I forget that sometimes. I forget there was a time that I had never seen this before either. Okay. So this is what Narcan looks like. Okay, it comes in these boxes over here. Right, we'll hand out. We'll give you guys these bags as well to make it easier to carry. Everyone should have Narcan on their person. So if you do check some symptoms, you've tried the verbal stimulation, you've tried some physical stimulation. What do we do next? We open the package, bada boom, bada bing. You don't need the instructions because you already saw the training and you know how to use them, so you can get rid of those things. Okay? Right? And it's this. Okay, so they've made it super easy. Right? It used to be a syringe, right? You have to piece it together, draw back. Some of the cats that have been working in the field doing this for a while, remember that? Okay? It's nasal spray. 0.1 milliliter fluid here. It's not going to drown someone, right? It's not going to poke their eye out. You don't worry about any of that jazz. Put it up the nostril as far as it can go, right? Don't jam it in there, but it'll stop itself, as far as it can go, and depress the plunger. All of it in one nostril. You don't got to do half and half. That's some of that stigma that's out there too. Save one for the other nostril, save one for later. Get it in there, right? Get it in there. Okay, it can take 90 to 180 seconds to become effective. All right, so while you're doing that, okay, we're giving them the space, we're making sure there's no dangerous objects around, things to bang their head, things to bang your head with, all right? Give some safe space, okay? Prepare to provide rescue first. Okay, so you tilt the head back, all right, so I'm laying down, tilt the head back, all right, push it all the way up, all right, and there's two.
That's it, slam, throw away.
That's it, throw it away, bam, gone. No, don't do that, don't do that. That's part of the stigma out there too, like, oh, these guys overdosing on the street, leaving their Narcan everywhere, right? See, I get excited when I see these. I get excited. Excited is maybe not the right choice of words, right? But someone used it. Someone had it. They reversed an overdose. Someone has another opportunity to engage in recovery. That's what it's all about. That's what it's all about. Okay? You have questions?
So it doesn't matter the right or left?
Nope.
Okay.
Yeah. So they got a deviated symptom. We're not going to know that in the moment, right? So like, what I will say, if you're going to administer multiple dose, you want to alternate. Okay, you want to alternate. So first one goes in, right nostril, no response. Immediately, don't wait 180 seconds. Please don't sit there. 1 Mississippi, 2 Mississippi. Don't do that, right? Administer the other one in the opposite nostril. Okay, same thing. Keep doing it until you need to, until you get a response. As many as you got if you got it. Like I said, my last one, God willing, my last overdose took 5 Narcans.
Can't hurt you?
Cannot hurt you. You cannot overdose on naloxone, cannot overdose on Narcan. All right, there's no such thing, at least I haven't heard of it, it hasn't been documented. I've been doing these trainings, I've sat in a lot of trainings for a couple of years now. Even with the 8 milligram ones now, I carry around an 8 milligram one on my badge now, because I know one is seldom enough.
So for these ones, just one spray and then toss it. You don't give it one out.
Yeah, exactly. Yeah. So they come 2 kits per box. Okay, so I do suggest if you're going to take one of these pouches too, if you're going to take one, make sure you have 2 of them. Make sure you have 2 of them.
Are the symptoms worse because you mentioned you had 5, like the after symptoms, are your symptoms so much more intense because of all the...
Yeah, so I was immediate precipitated withdrawal when I came to, so felt like day 4 or 5 of detox, body sore, right? We don't need to get into the logistics of it, but you get it, someone in active withdrawal was very painful, right? But with that being said, because of that, I used heroin when I got out of the hospital. I didn't inject it, right? Because that's how I overdosed, right? But I only knew of one way to feel better at that time, right? And I didn't go back out. I finished that stash and then I went into treatment 3 days later, and I've been rocking a program ever since. But you think that. That's why I talk about that being at higher risk, especially after an overdose, especially if Narcan was administered, because we feel like garbage. And our diseased brain tells us there's one thing that'll make you feel better, Jerry. I know it almost just killed you, but we'll use it safer this time.
Doesn't work.
It doesn't work like that. Unfortunately, it doesn't work. Yeah. When all the pain is the fact that you're breathing, right? So you place one hand over the person's chin, tilt the head back, pinch the nose closed, place your mouth over the person's mouth to make a seal, and give 2 slow breaths. Watch the person's chest, right? And not the stomach rise, so you want to see the chest rise. Okay. If you don't have a mask, right? Katie reminds me of this all the time. You can use your t-shirt. Use your t-shirt. Okay, if you want to go lip to lip contact, you can put a t-shirt on there and breathe that way. All right? So these are some do's and don'ts. Now some of these may seem obvious, but I had to put some don'ts on there too. So do attend to the person's breathing, cardiovascular support needs by administering oxygen or performing rescue breathing and/or chest compressions, depending on whatever CPR training you've done. Do administer naloxone and utilize a second dose. If no response to the first dose, no response to the second, use a third, so on, so forth, until you get a response. Don't just sit there and say the instructions said 3 minutes, so no, don't do that. Okay. Do put the person in the recovery position. So this is the recovery position right here. Person on their side, arm under their head, knee over the body. Okay, so we put them on the side, because if they do induce vomiting, or they start vomiting, they're not going to choke on that vomiting. Okay, and it's slower to get up too. So if they do come to, right, they're going to shoot up. And then they kind of got to roll over, and you got a second to say, all right, this person is coming to. Give them their space. Okay? And the knee stops the body from rolling over and flopping over. Okay? Do stay with the person and keep the person warm if you're comfortable doing so. That's a big one. If you got to bounce, you're afraid, okay, do those things. Administer the Narcan. You've called 911. You've administered the Narcan and naloxone. You put them in their rescue position. Then you can bolt off if you're going to. Right? It's not so much for us, probably as people that are still actively engaging in substance use or nefarious activities. They're going to want to run for the hills. Oh, no, not you cats, right? We're going to stick it out. We're going to stick it out to help.
I got a question.
Shoot!
Should you take the empty Narcan that you used with you, or should you leave?
I'd take them with you. Right? So it's good because the EMTs would like to know how many you've used too. And I'm saying so we say leave them like litter?
Like, leave them near the body?
Yeah, so, there it is. Good point. Very good point. So if you are going to leave, right, you've called 911, you've administered naloxone, you're going to leave the individual there by themselves, leave the Narcan by their persons, so that way first responders can tell. Okay, this is an opioid overdose. They've administered Narcan. They're non-responsive. We're going to need more Narcan or an additional intervention, right? So they can kind of make heads or tails of this situation. Thank you. Shoot.
The answer might be the same as before, but does it matter the side of the position that you're putting them in?
No.
You
Yes.
know how they say you're supposed to lay
Yeah.
on your left side because your heart's on that side?
So it doesn't have any effect. I haven't heard any studies of saying more effective. Great question, though. I lay on my right side, I get heartburn. The other side, not so much. So I, it's a safe spot. Either way.
And then, how fast will they respond to the Narcan? Before you do the second?
So it matters. It matters. Rule of thumb, if you go according to the instructions, it will take, a minute and a half to 3 minutes. That's not always the case. I've seen it within 30 seconds. 15 to 30 seconds could be pretty quickly if it's a low dose of opioids in there. It can take up to 3 minutes though. That's too long, right? Someone 3 minutes in an overdose, right? Stand there not providing rescue breaths, not doing anything, right? A lot can happen. A lot can happen, Okay.
Just curious, you had mentioned that you had a unique vial of 8 milligrams. What's the standard dose in the nasal spray for that Narcan?
It stands. These are 4 milligrams.
4 milligrams.
Yeah, sorry. Yeah, these are 4 milligrams. So 2 in a pack, and the other boxes come with 16 milligrams.
Oh, okay.
In there, Unfortunately, the state still won't. I can't get the big ones yet through the Narcan purchasing program that I ordered, all our kits from yet. And it's super expensive, but we'll get there. Narcan is on shelves now. That was not a thing a year ago, right? A little bit more than a year ago, you had an active prescription. Anyone in Massachusetts can walk into a pharmacy and walk out with a prescription of Narcan and then just simply pay your copay. Now we can do that, or we can purchase it on the shelves. It's out there everywhere now, and I'm hopeful that, the rest will trickle down as well, the more potent, dosages. Okay, so don't slap or forcefully try to stimulate the person. It will only cause further injury. If you cannot wake the person by shouting, rubbing your knuckles on the sternum, center of the chest or rib cage, or like pinching, the person may be unconscious. Okay, that doesn't mean slap them harder. It doesn't mean get a glove. It doesn't mean that. Don't put the person into a cold bath or shower. I just want to hear often, right? It kind of that would make sense to me, putting in a cold shower to kind of shock the system to wake you up. We're putting people at risk. Nobody's home. For slips and falls and for other potential injury, right? We want to keep them safe. Yes, increase the risk of drowning or going into shock. Okay, don't inject the person with another substance. All right, this. Yeah, don't inject the person with another substance. Some of the examples that we hear out there, salt water, milk, or stimulants. I can get the mentality behind, I think, stimulants trying to reverse it. I even kind of get the mentality if you're trying to put like a saline solution or salt water in there to try to thin out the percentage of the drugs that are in their blood. It kind of makes sense. It doesn't work though. It doesn't work. Milk, I don't get. I don't get why people, maybe they didn't have water. I don't know. I don't know why someone would use milk, but that's a real example that has happened, that has had an adverse reaction to it. That's why I put it on there. Like, we do not inject the person with anything besides naloxone, besides Narcan. Okay, don't try to make the person vomit drugs, right? Try to be sticking your finger down anyone's throat, doing stuff like that. Swallow, choke, or inhaling vomit into the lungs can cause a fatal injury. That's another reason for the recovery position. Okay. So that's meat and potatoes. All right, how to identify, how to respond to an overdose. Does anyone feel better equipped to identify and respond to an overdose? Okay. Does anyone not feel confident that they could identify and respond to an overdose? You don't want to put yourself on blast, I get it. I don't think I would either. Right? You can talk to me after. Courtney, right? You guys know Courtney, right? Nurse, got medical experience. Katie's our community health worker. Taylor's our recovery coach, all Narcan trained. Now, Courtney's got the medical professional lens as well. Provide some different things on it. Yeah. So should we go over the tests? Want to grade your tests? It's pass, fail, guys. If you failed, you don't get any of this. No, I'm just kidding. No. I just kind of want to see, like Evelyn said, I'm a visual learner and it helps some stuff to stick. It helps some stuff to stick, okay? So first, what are the signs of an opioid overdose? Select all that apply. Who wants to share?
Death gurgle.
Okay, snoring or gurgling sounds. Yep. What else we got? Blue lips, right? Blue lips or fingernails. Okay, yep. Is that what you're going to say?
Yeah, I was going to say everything but C.
Everything but, okay, there we go. Everything but C. If they're responsive, it's not an overdose. It's not an overdose, all right? See, Courtney's sharp. She's trying to make sure you guys are paying attention. Okay, what are the characteristics of this disease? Select all that apply. Which we'll talk more about this upstairs.
I don't think everyone has their tests.
Oh, they were turned in. Oh, okay. We're graded 6 out of 8, 6 out of 8.
Symptomatic.
All the above. All diseases are symptomatic in nature. Granted, the symptoms of disease of addiction may be different, right? We got like deceit, manipulation, right? Dishonesty, but we also got withdrawal, cirrhosis, the list goes on, but still symptoms nonetheless. Progressive in nature. All diseases are progressive in nature, right? And that's part of that stigma that's out there. There's a time when we chose to use drugs or alcohol, which we'll talk about the dopamine and the reward system upstairs if you guys care to learn a little bit more about that, okay? And it progresses to a point, right? So they didn't wake up on these streets homeless. It progresses to that, unfortunately. And my favorite and the most important, all diseases require a course of treatment. All of them. We do not have the ability as of yet to cure ourselves of our own diseases. Addiction is in that class too, right? The treatment may be a little bit different, right, than some other conventional treatments for other illnesses, but still requires treatment to become in remission as well. Okay, fill in the blank. Narcan is a prescription medicine that is used to the treatment of an opioid overdose. So Narcan or naloxone. Okay, naloxone is the medication name. Narcan is the brand name for it. Okay, Cladex is another one. Right, Cladex is another one you'll see out there. I don't know why they went with that one, even with the
They look just the same.
they look just the same. Yep. The other ones have an orange plunger and some orange stickers, but they'll all be shaped like this. They all come in these little foil pouches here with an expiration date on there. which I will share. A recent study just came out from the Harm Reduction Center. Okay, they administered a Narcan. They reversed an opioid overdose with a 30-year expired Narcan. So if you have one like these right here, if I don't use these are expired, these are still going to go in my car. Right, so I legally can't hand these out to patients, things like that. But if I got someone in potential overdose, I'm going to use an expired one before I would use anything. Right? There's no documented adverse reactions to using an expired naloxone, opposed to one that just came off the shelf. Use what you got. Use what you got. Okay, so prioritization questions in the order. So it goes B first. Call 911. Then it goes A. Give Narcan. Give breath/CPR, and then stay until help arrives, if you're able and comfortable to. But now we all know about the Good Samaritan law, so now no one needs to run anymore, right? Sweet. Okay? Correct the false statements. Okay, if the person is not breathing, make sure there is nothing in the mouth, tilt the head back, lift the chin, pinch the nose, give a breath every 5 seconds, and watch for their chest to rise with every breath. That is a true statement. Oh, that's true. Okay, another true statement, number 2. If there are symptoms of an overdose, tap, shake, shout at the person to get a response. If there is still no response, rub your knuckles on his or her breastbone. Do not rub for more than 30 seconds. If no or little response, call 911. See, what kind of messed me up on that one is shout at the person. Now that shout has a negative connotation to my soul, right? But that's what we're doing. You're yelling their name. You're yelling hello. We're yelling Narcan. We're yelling breakfast. Whatever it is you're yelling. Or shouting, excuse me. Something, okay? Hey, Narcan nasal spray may be dosed every 4 to 5 minutes if available. That one is false. Okay? It's 2 to 3. It's a trick question. Courtney's good. Courtney's good. It's 2 to 3. Don't wait that long. It's too long. All right? I say every 2 minutes is too long. You got him? Keep it. Okay, substance use disorder is a preventable and treatable disease. That is true. That is true. I'm standing here before you, right? Someone in long-term recovery because I was connected with, someone kept the hope alive long enough, right? Didn't give up on me until I was connected to some services and supports, learned some education, right, on how to maintain a program of recovery and improve quality of life. It's a treatable disease. It's a treatable disease. Right, and there's various levels of treatment for this disease, right? So it's important that we meet the individual where they're at. No judgment, coming from a place of empathy. Don't tell someone they should or shouldn't be using drugs. I'll talk more about that upstairs, okay? They know. We know. Knew I wasn't supposed to smoke crack and shoot heroin. I shouldn't know how to not smoke crack or shoot heroin yet. People in that space too. They know. Right? People know what our issues are. Right? So don't do that yet. Okay? Any questions, comments, concerns? Bueller? Anyone? No? Okay, shoot, Jack.
Hi, I've heard that if you leave Narcan in your car, it can freeze, and that does affect it. Do you know anything more about that?
So it can, right? So I'll share this. So this was probably about 4 years ago now. I had a couple of Narcans in the center console of my Jeep for over 2 years. We live in New England, right? The winters, summers, right? It still brought the woman out. Still brought the woman out of an overdose. So if you're able to, I leave mine in my car. Just to make sure I have it in there because I'm afraid if I don't, I'm going to forget to bring it. I'd rather have it in there. I'm sure it may decrease some of its effectiveness. There's no studies to show. It does say the temperatures that you want to keep it in between if you're able to.
But it's still worth trying.
It's definitely still worth trying, right? And I wouldn't say all right, I got to bring this in the house every day. Because then we got to remember to bring it out every day. And if it's one of those days that you forgot to bring it out, then it's definitely less effective than one that's been frozen, because it's non-existent, But great question, great question.
Excuse me.
Sure.
Yeah. I have a question. Does opioids or whatever it's called, does it have anything to do with mental problem?
With mental problem?
Mm-hmm.
So, no, yes and no. Right, opioid use does not directly cause any mental illness, right? So it's not going to cause But with that being said, some symptoms of prolonged exposure to drugs or alcohol, right, is depression, increased anxiety, right? It does work, it does affect your limbic system, which is your reward or your pleasure center, right? So your ability to feel pleasure. But that kind of goes, what came first, the chicken or the egg? You know, a lot of it, you know, have underlying mental health symptoms first and start using opioids or other substances to try to mitigate some of those symptoms. On the flip side, right, so we'll use it to start having a good time. As the disease progresses, right, as the disease progresses in our lifestyle spiral, right, our stressors get increased. Our depression increases, anxiety, trauma related to someone actively using drugs. So PTSD and complex PTSD are very much a thing and synonymous with people that use drugs or alcohol.
Does taking drugs for a really long time, like this particular drug, does it damage like your brain cells, or does it damage anything that even after you stop, you still don't really get back like mobility or?
So yeah, prolonged exposure to drugs or alcohol do have detrimental effects on the mind and body. You know, different drugs have different effects. Opioids isn't a big one, like Molly and MDMA are the big ones for like, the Swiss cheese in the brain and actually, eats holes in the brain. Usually direct exposure to opioids, the negative effects come from the overdose, or the oxygen deprivation. As we continue to use drugs, we're cooking brain cells. You remember the thing of this is your brain on drugs, the fried egg, it does have detriment. With that being said though, enough time removed, a lot of that can repair itself. Our minds and bodies are super powerful things. I can check, I didn't come back fully from my third overdose. Right? I can't text with both thumbs anymore. I stumble my words sometimes. I'll start writing and I'll start with like the second or third letter. Like now I chuckle about it. Wow, it was pretty scary and early on though. Wow, oh my gosh, I toasted my brain, I'll be cooked for the rest of my life. I'm still cooked, but it's just not to the extent. We can repair it ourselves. The big one though is which I'll do, I have a PowerPoint I'll put on upstairs too that talks about some of the risks of prolonged exposure. Cardiovascular, endocarditis is a big one, right? Cirrhosis of the liver, hepatitis C, those are kind of some of the big ones that are more prevalent. Respiratory issues, if they're smoking drugs.
So we might get into it later, but people who use drugs recreationally, like marijuana, that we know like some of those are getting laced now too.
Yeah.
So are testing strips as easy as, is it easier to get testing strips or like Narcan?
Just as easy for me.
Because like for recreational drugs like marijuana, a lot of people are experiencing overdoses to those that like so I'm wondering if testing strips are accessible.
So not like CVS and things like that. You can get them, the Clearinghouse, Clearinghouse Harm Reduction in Mass. They're free. Anyone can order up to 500 at a time. That's where I get ours from too. I am more than glad to. Unfortunately, it's not there yet for you to be able to walk into a pharmacy and get them yet. Pretty much every treatment center has them. I make sure my staff has them on them. I usually put them in the naloxone bags.
What is this?
So these are called fentanyl testing strips. So this young lady was just speaking to some other substances, cats that are using marijuana, cocaine, pills from the street pharmacist, anything besides opioids. Tell everyone, if you're using opioids, don't waste the time, don't waste the strips of fentanyl. Be prepared, have Narcan ready. This is if you're procuring other substances from the street. Unfortunately, we have seen people experience overdoses from procuring marijuana on the street that was laced with fentanyl. Right? More often it's unintentional. It's not like someone's sprinkling some fetty on there, but it's usually they're selling other drugs, breaking it up on the similar workstation, it cross-contaminates, and it gets in other substances, And the other drugs, though, they're actually lacing it intentionally. Cocaine, right? Xanax or the pressed benzodiazepines that are out there on the street, they lace it with fentanyl. A lot of the pressed pills out there, that's what they are. It's fentanyl to be able to test your stuff. Which these are very easy to use, which I can do.
How do you use it?
How do you use it?
Oh, it's my first time.
Okay, good, yeah, so it's similar to testing a urine. All right, if anyone's ever taken a drug test and you pee in the cup, all right, and you dip the little strip in there, only you don't have to pee in a cup. This you're actually testing the substance. So we have little kits too. You know, they have the solution in there, the fluid too. So the number one question I get asked all the time is, how much drugs do I need to waste to test my stuff? I said none. Okay, so powder, right? Flip it around the bag, put it in another container. Okay, so these are cookers too, but put it in another container. Put the solution in there, swish it around, get the stuff off the walls, dip the strip in, hold it for 15 seconds. If the line shows, it's positive. Fentanyl. Use less, right? If usually you inject it, use a different method, hopefully. Make sure you have Narcan handy. If you're a solo user, have them never use a lone hotline on the reg. You guys are familiar with that. Shoot.
One thing I'd like to point out with the testing strips is usually when people see 2 lines, it's positive. With these, it's 1 line.
It's 1 line's positive. Okay, it's not like a COVID test. COVID 2 test is positive, right? 2 lines is positive. It's 1, right? Okay. Shoot.
Sorry, I missed, what's going in the container, like, what is you getting from the?
So the substance, right? So say someone says, Jerry, I got some cocaine. I want to know if there's some fetty in it. Okay, what do? So you take the cocaine, put it in another container, dollar bill, another baggie or something. You got some residue left in there. You want to take the solution, okay, take the solution, squirt it in the baggie, give it a little how you do ski, all right, mix it around, and hold the strip in for 15 seconds. You can test it right in the bag too. Test it right in these bags too. Hold 15 seconds and look for your 1 line. Okay, 1 line is possible.
Jerry, are we done with the slide?
Yeah.
Because, the cleaner's we gotta clear up down here and go upstairs.
Okay, so let's transition this up. Let's transition this upstairs, and we'll continue to dive into some of this stuff upstairs.
5-minute break bathroom and then leave right back upstairs. And he can answer more questions.
Absolutely.
That's not a quick That's awesome. I just need to learn something.
Where's your bag? Well, now I kind of get all of it.
Interesting because I've done this.